Hey everybody, my name is Kayla and this is Keith.
Hi, I'm Keith.
We are going to do a bag change today, but with a twist. He's going to change my ostomy bag for the first time ever.
Yeah.
Are you nervous?
I don't know what I'm getting into.
I'm nervous. I feel like the only thing I'm nervous about is if the stoma is gonna like poop.
Be active. Yeah, sure.
And it's going to. I'm certain of it.
Normal.
I ate about an hour and a half ago, and I tried to like stop drinking anything at that time too. So except for
No
like little
Mexican
sips.
food.
No Mexican food. Yeah, that was.
That was the deal.
So I am really nervous. Isn't that so silly? It's okay.
Yeah.
It'll be good. So I thought this would be important to do because I know there's a lot of nurses out there who maybe aren't as familiar with ostomy bags, and you might see a patient or two in your career. And I feel like there's also a lot of caregivers out there, and who knows, like someday you might have to change mine for whatever reason.
Yeah.
And I just wanted it to be something that is like educational but also real life. Like I don't expect you to know what to do at all, so I'm gonna guide you 100% and kind of talk about like tips and tricks along the way. We can just put that to the side for now, but the important thing here is gloves. You're probably gonna wear gloves. I never wear gloves when I do my own, but that's just because it's my own body, you know. I kind of feel like that's how a lot of us do it. So I do have a couple of friends who are nurses who supplied me with some questions that they had, and so I really want to touch on those. I took some notes extensively. But I just want to make sure that, you know, we kind of go over some things. This is going to be, just so you know, this is going to be a long, in-depth video, but I'm really going to go through each step, you know, in pretty good detail because I want you to feel comfortable. It's not one of those things where you're like, oh, if he, you know, messes up or whatever, I'm not gonna just be like, oh, I'm not gonna say anything, like I need this bag to stick on me, you know what I mean? So like if it's something where like, ooh, actually I can help correct it, then I'm going to.
Yeah.
So if you do want the like quick and dirty version of it, I do have one that I'll link in the description below. So you'll notice the bag that I use. The bag in the quick version is the one that hospitals usually use, which is a Hollister brand. I do the Coloplast brand for a couple different reasons, and actually I'll kind of tell you about that too. So the hospital usually has Hollister, and those are good, but for my skin, I'm really sensitive to certain adhesives. So I end up being very allergic to it. Broke out in basically like hives on my skin, and it was not good. So I had to switch brands of bags. So you might have that where if you are a nurse and your patient comes in, if they know that about themselves, they'll probably bring their own supplies, like if they're going into the hospital and know it. Sometimes you end up there and you don't really, you know, have your supplies on hand. But anyway, that's why you might see that they have a different type of ostomy supply. And the perk is too, like if somebody who has an ostomy bag and they've had it for a while and you're their caregiver and helping them change it, chances are they're going to be able to help you walk through it all the way, and it should be a breeze, hopefully.
Yeah.
You know, but yeah, so there's different brands of bags. There's even more brands than the one, you know, the two that I just listed. First step, okay, so when you're first doing any sort of change, you're going to want to gather your supplies. You can have like a puppy pad or something, like if you're at home, or in the hospital you got these lovely pee pads. I had this when I was pregnant, and what's kind of nice about this is you can actually tuck it into, you know, I suppose someone in the hospital is wearing like a hospital gown and maybe like underwear or something, or you can at least just lay it over their lap underneath the bag. And that will just help if there's any times where the stoma wants to let loose. So I wanted to tell you a couple different tips. One tip is the best time of day to change your bag would be in the morning before you've eaten anything. Of course, when you start eating, it's going to make that stoma active, and by active I mean it's pooping. Let's be real here. So I'm nervous.
It's okay.
It's just so silly. This is a couple things to look out for when you're doing a bag change on someone. You're going to notice that the stoma is red. And okay, also too, I'm telling you this now before I have the bag off, because once we have it off, they're unpredictable. That's the fun thing about stomas. I can't always tell when something's going to happen. So I just want that time frame to be as short as possible. So I'm going to tell you all these like little tips and tricks before and as we're going. But the stoma looks very red and wet. So it looks like it's would be painful, but it's not painful at all. There's actually no like nerve endings on it. So if it's red and wet, good. That's a healthy stoma. It should have good color to it, because think of like the inside of your nose. If you ever blow your nose too hard, or like if you are picking your nose, then you get like some blood.
Right.
It's because the capillaries are so close to the surface of the skin there, and it's the same thing, which essentially the stoma is like the inside of my intestine. It's been like flipped out and sewn onto my belly. So what we're seeing is the inside, and that's like healthy blood vessels, which is a good sign of a good stoma.
Good sign, yeah.
So because those little blood vessels are so close to the skin, it's often that you can, you know, if you touch it too many times, there'll be some bleeding. And that's normal, so don't freak out about that. It happens to me even with a light touch sometimes. And so if that happens today, like that, it's okay, you know?
Normal, got it.
Yep. And so you want to just make sure that you're like careful around it. Oftentimes too, like if someone says their stoma is hurting, they don't actually mean the part that's protruding out. It'll be the skin right around it. If you have irritated skin, or maybe the seal is not quite sealed anymore, you have output, which is the poop. It's very acidic. I have an ileostomy. I don't know if I mentioned that. So mine is a little bit more watery and, you know, very acidic. So if that sits on your skin, it actually burns the skin. And that's why it's really important whenever someone says like, oh, it's really itchy under there, or like it's burning, or it's hurting, you want to change that, because if it sits on the skin too long, it eats away at the skin, and then it's not very pretty.
Yeah.
It just takes a long time to heal, because think of like you're trying to put an adhesive thing over an area that has an open wound, essentially. As far as like how often to change the bag is different for everybody. I typically try to aim for about 3 days, but a lot of times I can stretch it as long as like the skin is healthy and everything is going good. It's not itchy, it's not burning. I can stretch it up to like 5 days. I've stretched it up to 7 days before, and I paid the price because my skin broke down around it, and a lot of that was just new mom not taking care of myself first kind of thing. So make sure that your patient or whoever you're caring for stays hydrated, and kind of like keep track of what their output looks like. If it's too watery, I know for me, I can't chug fluids or it goes right through me. And so, you know, make sure they're sipping on water all throughout the day. Just really stay hydrated, because you're missing your large intestine, which is a really vital organ in reabsorbing water. That's why poop for a normal person is more solid, because they have that time throughout the large intestine to reabsorb water in the body, and then their stool becomes hard. So people with colostomy bags, they'll have a little bit more firmer output and a little bit less often of output. Ileostomies, I gotta empty my bag like, I don't know, 8 to 10, 12 times a day. I don't really count. It's just kind of like whenever I go to the bathroom, or whenever the bag is about like half full. Now overnight, it tends to get all the way full with like air and stool. So it'll wake me up. Like I'll wake up and I have to empty it 1 or 2 times a night. So try to get ahead of that though, because if you let it get too full on somebody, it can start to try to like push away from their body, and it'll find a way out. If it doesn't have a way out through the bag, it'll find a way. And then you have a mess.
Yeah.
What happens if there's no output at all? So output is something that we call the poop. So if there's nothing coming out at all, and it's been a long time, and they've ate and they've drank, sometimes you can have a blockage. And I've only had a couple times where I've actually experienced that, and both my situations were because the opening of my bag was too small, and literally as soon as I took the bag off, it was like, woo! It just free flowing. So that was the issue for me. But there's certain things that you can try too. If you feel right around the stoma, if the skin feels firm, that means it's ready to release. And you can try like massaging the area there, and that should let it out, which also happens if you're doing a bag change and you're trying to like clean the skin. Mm-hmm. If it's firm there,
it stimulates.
And it just like it goes. It could be too, if you're like fresh out of surgery, I remember this happening to me in the beginning, where my stoma was still pretty swollen from the surgery, you know, you're healing, all of that. And so I had corn, and I remember it hurting so bad to try to like get out, you know, because it was a smaller opening because it was swollen. And so just that feel like, I feel like every like pop of the corn, popcorn. But yeah, so it might be food that's not totally digested. You can have people try a couple different things, like make sure they're eating, make sure they're drinking, get them up and walking, because sometimes walking around helps stimulate it too. Massage the area, do like some heat. You can also change your position where you like, you can rock your knees back and forth, you know what I mean? Or just like crunch around, kind of like move the abdomen, and that'll stimulate it too. You know, the hospital is not always gonna have the same supplies as like what I have at home. There's certain products, especially whenever you're taking the bag off, I can't remember what it is. You use it to like remove medical adhesive. I know it's like meant for that purpose, but for whatever reason, it's really oily like the hospital one is. So make sure that you take like a gauze sheet or something, wet it down, and then really like wipe the skin, dry it good, make sure the skin's not oily at all under there to make sure that the new bag is gonna stick to the skin, because a new bag will not stick to anything that's like wet, oily, liquidy, anything like that. Blood, so like if the stoma's bleeding around it, I'm going to show you today, because I'm sure I've got broken skin around there, I usually do. So I'll show you today how we kind of combat that, because you want to make sure that the area is as dry as possible to stick to it really well. So here we are, step 1. Gather your products. Thanks for listening to me talk for 15 minutes. Now he's got lip gloss too.
Yeah.
Okay, so we've got the gloves on. We've got our puppy pad, is what I'm going to just call it, whatever.
Yeah.
And then I always like to have this little station here with all my supplies, and then I set them out because you never know what you're going to need, and honestly, get extras. Okay, so whenever you're doing a change on someone else, obviously the first thing that you need is an ostomy bag. I always make sure that I have a couple of them on hand. Now, when you take them out of the box, they're gonna be undone like this. So you wanna close the flap, because if you go through all that work and you applied the new bag and then their output starts going but you haven't closed the bottom of it yet, you're gonna have a mess. So you can do it in the beginning or at the end. I actually, for a one-piece bag, I wait till the end because I like to make sure there's no air in the bag. So we'll go through that, but if you have a two-piece bag, that's kind of something that's good to do. Anyway, they're gonna look like that when they come out of the box. You're gonna have an adhesive remover. It'll either come in a spray, which usually hospitals won't have this, but most, well, I shouldn't even say most patients, but if a patient doesn't have this, get it, because it's amazing. They also have a medical adhesive remover wipe form, so it could be either one. You're gonna use both, I use both. So we're gonna set that out. And I'm gonna kind of put them out like in the order that we'll use them. The bag will be last, but you know, we'll put them here. Then, after you're removing it, should I go through and lay all this out, or should I like talk about it while we're doing it?
You could talk about, I think the supplies is very important to know what they need.
That's true, that's true.
And then other people need to know.
Yeah.
You know, if they're ever going to do it for somebody or care for somebody that has this,
Yeah.
they've got to know.
And that's a good point, because especially like once you get into changing the bag and you have the bag off of the person, you kind of want to get the new one on as soon as possible to avoid a mess. So having the supplies out first is a good idea. So, all right, we've got our medical adhesive remover. A lot of people are worried that like, is this going to just fall off if I take a shower, take a bath or anything? Nope, this is very sticky, which is why you need a special spray to remove it. Now, there are times where it could come off. If your skin is wet at all underneath the adhesive, that can make it not stick as well. This is really helpful for any sort of cleanup. I've also used paper towels in the past, but I just like the way that the gauze feels on my skin. It's softer.
Yeah.
We have stoma powder and then no sting barrier film. This also comes in a wipe form. Also too, like, this is all the stuff that I use for a bag change. This might be different for somebody else, but I think relatively we all do sort of the same things. This is what we're gonna do to stop any bleeding, or if we have any sort of like open wound around the stoma, we're gonna basically put a bandage over it with those two products. We have a couple options for putting right around the stoma. You'll often see this with people. This is a barrier ring. This is gonna go around the stoma and underneath the bag. So I've got my skin, you're gonna do the seal, and then the bag over it, and that really helps to prevent any leaks. It kind of gives it like, it fills in the gaps around the stoma bag. But sometimes stomas are not perfectly round, and so you have some extra little cracks and crevices. So somebody actually recently told me about this. This is stoma adhesive paste. It's phenomenal. What I'll have you do, and you know what I do now recently, is it's kind of like a gooey paste. I'll kind of show you what it looks like. Oh, just got some on the floor. So it's a gooey paste, and so you see you have a little bit more flexibility with like how much you use. You'd squirt it on the inside of that. That just kind of like really molds right around the stoma, and I feel like it's made a big difference in the skin around my stoma, so that's exciting. You've got a trash bag. This is important. You want to throw away your ostomy bag with that. This is something that comes with every ostomy bag, and it is kind of cool. It is a measuring tool, so you can see how big your ostomy is, and you literally, once your bag is off, you can hold it up and measure to see what size hole that you're going to cut in the bag. So this is really good, especially if you are new to the patient or new yourself to, you know, what your ostomy size is going to be. Things can change the size of your ostomy, like gaining weight, losing weight, all of that. When I was pregnant, my ostomy grew, or my stoma grew, and then it shrunk back down to my normal size. So if it's always a good idea to measure someone before you put a bag on them. So it has different measurements. It's got inches on one side and millimeters on the other. And you'll notice on bags, it actually has both of the measurements. So on the top there, it's the millimeters, bottom is the inches. So whatever one you go with, it'll help you figure out what to cut. So that's a good one too. Oh, ostomy scissors. I use the angled ones because this helps me not cut something unnecessary, like the plastic that holds the poo. You know what I mean? Like if it had a sharp edge, then you could cut right through the plastic and then it would just go, like, what's the point of wearing a bag? Okay, so we've got that. I have a mirror here. This is just for my own checking whenever I do my own bag change. And then at the very end, you can use a seal around the edges of it. This just helps it to like really stay, you know, in place.
Gotcha.
Now that I've talked for a long time, this is gonna be a long video, but that's okay. We'll get into it. Yeah, so I'm gonna tuck my shirt up and out of the way. This is what I always do even when I'm changing my own. And then we just kind of bring the bag out and flop it over. And I just try to move like my underwear out of the way and stuff. So I'm gonna have this little pad thing here, and I'm just gonna like tuck it into my underwear, just like that.
There you go.
I'm gonna hang on to it while he's doing different things though, because that'll help if there's any output that happens. I can,
yeah, you can catch it.
I can guard you. Another cool trick too that I've seen before that I do now as well is I take the garbage bag and I tuck that in, because then this will help catch any output as well. Cool, so I just like put the bag in it, yep, and then I tuck that in. Perfect. Sweet. Yeah, I might turn like this, then you can see and I can see, or they can see. Cool. Alright, so first step, here we go. Okay, adhesive remover. So you're gonna go ahead and grab this spray. I always work top to bottom. I feel like that helps me get a good view on what's going. And so it feels like nothing's in there, right?
Yeah, I was wanting to shake it up,
yeah.
But it's not.
It feels like it's not full, but it is, which is really great for whenever you want to replace it. You don't know when. So you see this little tab at the top here?
Yep.
Usually, so it doesn't have any stickiness on it, which is why it's just kind of like flopped over.
Okay.
I always take that. It's kind of like a starting point. And then you just squirt. And see how it just gently peels
just comes
away?
Right away.
Yeah, I'm gonna go like this so that they can see
Yeah,
you.
let's see it better.
See, look at that. And it just like gently peels it away, which is really great.
Comes right off.
So my story from previous is I had a nurse who, I was like fresh after surgery, so my skin was still really sensitive, you know, and it was at the recovery recheck day. And she just ripped it right off. She did a couple sprays at the top and then just let it rip right off. It was so painful.
Yeah, and just so you guys know, I literally had I wasn't pulling at
you didn't have to
all.
pull
You
it.
just holding it, and as you spray, it's It works really well.
Yep. Okay, so you're gonna notice there is stool around the stoma. You guys can see that as well. And I'm like, do I bring them in closer? Let's do that for a little action shot. Oh, here's a good tip too. If you are sensitive to the smell at all, just dab a little bit of peppermint oil underneath your nose and then you won't smell poop. Okay, so you're gonna see that there is some output, there's some stool on my stoma. That's common. So this is where the gauze wipes come in handy. So you can just gently clean that off. And you might have to kind of like wipe it. See how sometimes it's kind of sticky?
Okay, yeah.
Yep, you got it.
I like to dab gently first and then just kind of work our way around.
Yep.
Because this is kind of sort of an open wound, right? So.
Exactly, yeah. And you can even like get down and like look underneath it. You want to make sure it's all clean underneath there.
Yep.
Good.
Make it clean.
Ooh, that's a little bit painful.
Yeah, I can tell.
As you can see, there's some that's like stuck to some gooier parts. So we're gonna take the medical adhesive remover wipe, and if you feel the need to, if you need to like wipe off your gloves at all, you can always do that with that too.
Yeah.
It's an easy thing to get really messy.
Yeah, and you want to make it clean.
Yep.
Well, we got a trash bag right there.
Exactly. So you can take the adhesive remover wipe. So what I do with the gauze, and what I recommend, is just kind of like getting a little bit of the stool off, but you don't have to wipe too hard because a lot of times it's going to be stuck to the adhesive from the bag, from that previous bag. So this is going to help to get rid of any of the goo, any of the gluey remnants. You're doing a great job.
Thank you.
You're welcome. So I kind of utilize both the spray and the wipe here. I can turn this way so you can really see good. And I feel like the bonus of using both of them, the spray really gets the bag off of your body really well. And then the wipe can really help to get right in there and get all of the stickiness off. Yeah, perfect. So he's doing short little strokes, and I feel like that really helps me whenever I'm doing it too. Now I'm just gonna warn you, I think I didn't tell you this part too, but the stoma will dance, and that means it's getting ready to let go of some output. Also too, I feel like it's kind of firm, maybe not, it felt like it was kind of firm at first up here, which usually means that there's some stool ready and waiting. Okay.
Okay, so there's a little yellowness right there. Is that,
yep, so
is that glue or?
It is, okay. Yep. So I would go ahead and grab another wipe, and this one right here.
Okay.
Because that's a big thing. We want to make sure that all of the previous glue and all of the stool is off of the skin. So that's a good thing to do. So I don't know if you guys can see, but it's like moving around. It's so weird, but the way that your intestines move food down is I think it's called like peristalsis or something, but it kind of like does this like inchworm kind of motion, and that's how food moves through your intestine. Yep, perfect. Wahoo.
A little bit on the bottom still.
Okay. As someone doing this on someone else, do you think it would be easier if I was like sitting on a bed?
Probably the next, like, being, you know,
because then you can be more eye level. Yeah, that makes sense. Cool. Okay, looking good. I just like to check the progress. So as you can see, as you guys can see, and you can see too, there is some like skin irritation. Now, I will say, you'll see this like redness right here. See how it looks like a ring around it?
Mm-hmm.
That is just from the design of this bag. Nothing to be worried about. It's just that it's had a constant pressure on it. So it's going to be a little bit darker colored than that. Anybody who uses a deep convex, this is like a very firm, you can feel it. It's a very like firm structured thing.
Yeah.
So that's going to be, if it's pushing into someone's skin all the time, that's why that's going to look dark red. But what I'm talking about whenever you have like skin breakdown is where you can actually see that broken.
Yeah, it almost looks like just a freshly opened wound, and
Doesn't
it's starting
it?
to bleed a little bit.
Yeah, it looks like I have like stitches and it's
Yeah.
like stitches held together.
And I've also noticed that the stoma has kind of firmed up a little bit. It was almost deflated, if you will. And then now it's, I don't know if it's the oxygen or a combination of food moving through.
Yeah, I think it might be just moving around. It has a mind of its own, you know. And then some people's stomas, so mine is kind of, it points down a little bit. Some people's, you know, it depends how much it hangs or whatever.
Yeah.
All right, so the next step, we're gonna try to see what size bag to cut to. So I'm gonna have you measure.
Okay.
And when you're looking at this, you know what ones are gonna be too big and too small. So you can kind of narrow it down that way.
Okay.
And you're gonna wanna put it all the way like to the skin.
Okay.
So that one's gonna be too small. You can see it's kind of like.
Kind of almost pulled the
Yep.
thing apart. Okay,
Yep.
so the next size up, that was 1 inch. This is a 1 1/8. And it seems to fit a little bit more flush, maybe a little bit too tight still.
I think it's perfect. Well, yeah, you're right. It might be a little bit too tight.
Okay.
At first I thought it was gonna be perfect because from my view on the top here, I'm like, ooh, you can see a little bit of the skin, which is what I aim for because I can fill in the crevices, you know?
Yeah. So this is next size up. That's 1 3/16.
Probably looks better, huh?
And I think this is really just a nice, perfect flush fit.
Yeah.
Doesn't pull on that perforation of
Yep.
any of these because these other ones just kind of broke from the moisture.
Yep.
So I think this is going to be the winner.
Woohoo! 1 3/8.
1 3/16.
Just kidding. 1 3/16. Good thing you're the one that's measuring. All right, so you'll notice on here we've got the lines. You can see on the bottom it has the inch measuring. So you've got 1, and then you got.
That says 1 5/16.
And what is our measurement?
1 3/16.
Perfect. So
in between that would be good.
exactly. So I'm gonna have you cut this.
Okay.
So I always go from this side here. Now I have a 1-piece bag, and so I always kind of like put the scissor in and then try to cut up to the point of where I'm going to cut around. Does that make sense?
Yeah.
So with 2-piece bags, I feel like it's a little bit easier because this one you have to kind of be careful, like cutting that and not going all the way through and cutting the bag. I feel like it's kind of hard to do that anyway with a nice scissor like this, but
Yeah, you just have to be intentional. But you guys notice these are inch measurements. Those are also the millimeter measurements that's on the other side of it. So like she said, you know, she likes to work all the way up. So we are going to be going for this dotted line that's in between 1 and 1 5/16. So
perfect.
here we go. Okay.
Yep, and you can use like further back on the scissor. Perfect. I find it cuts a little bit better when you put the scissor further in like that.
Yeah, it definitely does. And believe it or not, I have not used these scissors before.
They kind of feel like little kid scissors.
Kinda, a little bit.
So like really getting it in there.
Part out too?
Yep. Okay, so that's a good thing to note. So he was asking like, is it okay to cut the plastic and you'll see like the little gooey part? Yep, that's exactly what we're aiming for, is to cut through both of those layers. And don't worry if it's not perfect. Like, we're aiming for that measurement, but like I said before, we've got the different, like the barrier ring or the stoma adhesive paste, and that's going to kind of like fill in the crevices for where we need to like fill in the gaps, if you will.
So a little bit crude, obviously. You can see where it's not as perfect around the dotted line. Like she said, there's fillers for all that. So definitely not perfect. It's my first cut. So
not bad at all. All right, we can set that bag to the side. We're gonna focus on the skincare portion before we put on this new bag.
Okay.
So It has kind of like produced a little bit of output, so I always will take the gauze sheet thing and then just like kind of wipe that away and make sure that there's not any on the skin. Look at it, it's going. Oh my god, I'm pooping in front of you.
Good thing it's not our first date.
I know, right? Ooh. All right, cool. Good. I'm glad that you're constantly checking your gloves because this is a really messy thing and it's easy to spread it around. And like, I think that's why I don't wear gloves, is because I can feel it if it gets on my fingers and I just wash them quick, you know? Okay, so we're gonna do powder and the film. So basically what we're gonna do, let's start with just the powder. I'll put the barrier film back. We're gonna create kind of like a band-aid, if you will. So any of the wet surface around the stoma, we want to put a really light layer of the powder, and so you're gonna just kind of squirt it on there.
More so like around the whole stoma or around
nope, just around where the stoma meets the skin. Yep, exactly.
Okay. So I'm just kind of treating this almost like a salt shaker, because it comes out with very little assistance. So I'm just kind of tapping it like you would a fine powdered seasoning.
And you'll want to make sure you get it all the way around. And don't worry about like if you use a lot or whatever, it's fine.
And also do small little squeezes. That's what I'm doing.
There we go. Now it's serious. You've got the backwards hat. I think this is the most challenging part, because how do you get it to spray upwards, right?
Yeah, so that is a challenge that I'm running into that I'm not sure about. Oh, okay.
Yep.
You get a little bit at the end. Just squeeze it. It's okay to touch it a little bit.
A little bit. Oh! That was perfect. You kind of don't want to touch the skin though, if you can help it. All right, I think
I have some moisture on here.
Yep.
And
Oh
so
my god,
it's clogging it up.
Yep, that'll be it. I think I've got a little bit of stool on my skin too, so I'm gonna have you wipe that away with this. I can see it right here. And it's because the old Ostomy is deciding to erupt a little bit. Perfect. Good job. All right, so what we want to do is then take this tube. You did a really good job of doing like a light layer of it. I'm going to go back in, or have you do, I'll do one where you kind of have the powder at the bottom and it becomes like a little spray thing.
Yeah.
You can, you know, spray away excess, which you probably won't have a whole ton of excess, which is great. But you can kind of do that all the way around, and that just gets the excess blown away. But you did such a good job with the light layer anyway that it's just kind of like, oh, cool. Perfect. Okay. I do this too.
For good luck?
Yep. And then, yep, we're going to spray that on there. This is what I do. I don't know if this is right, really. Actually, now I'm thinking about it. But I've always done this. All right, so then we do just a light spray of this barrier film. This is a double bonus because my skin can be really sensitive to the adhesive in general, so I like to spray it all around where that bag is gonna go, but it also kind of like seals in that powder. Whoops, bless you.
So not on the stoma, just around.
Yeah, and you can kind of be far away. Yep. Perfect. All right. I like to do a couple sprays on the powder right around the stoma too. Just like do like one, and then you'll see it kind of create almost like a band-aid. Yep. See that, how it changed the look?
Ah, yeah, as soon as the powder gets wet.
All right, so hold on one second. You see how the ostomy is going?
Uh-huh.
Make sure there's no stoma on, or no poop underneath the stoma there.
Yeah, no,
so it's a constant wipe kind of game. I'll have you wipe it as we're going along. Sometimes it can get on the skin, so we always want to just keep it nice and, yeah.
Okay.
All right, is there powder underneath there, or is it all?
Yep.
Okay. Now that one is a pest and it likes to be upright.
There we go.
Woo-hoo. Sweet. Perfect. Okay, that looks great. Now we're going to take the bag that you cut so nicely. I'm going to have you peel that off, peel the sticker off. Perfect. And then I'm going to have you do the Stoma adhesive paste. So basically you're just going to kind of like give it a nice little squeeze. You kind of have to work this around that to like get it to stick on there, you know. I'll kind of do a little bit, but you know what I mean. And it can be nice and like thick like that all the way around it, and even if some of that gets on my stoma, it's totally okay. It's like applying a filler almost.
Like a wood filler?
Yeah. And having it be more on the inside of that bag is better.
Is it still better?
Mm-hmm. It's kind of hard to work with.
Can I touch this?
Oh yeah, you should be able to. If you touch it with your hands, you'll never get that sticky off. But gloves will be a different story.
And after this, I'll go ahead and change gloves. At least.
Oh, sure.
This one, just to be on the safe side.
Sure,
Make sure. Yeah, go ahead.
Sorry, I was kind of working against you.
I think gloves is going to work best. Then we don't have to worry about getting it off.
Yep. She's working. She's pooping. I'm really happy it hasn't done it as much as I thought it was going to. I was really nervous about that.
Okay.
Alright. I'll help you with the next. So I always have extra supplies.
Okay.
Perfect. Alright, so before we put on the new bag, we're going to wipe the end of the stoma one more time because it is active. And this isn't even that bad. And then always double check that the skin doesn't have any on it, like right underneath it. Sometimes it can...
Nope, you're good.
Yeah, you're good. Okay, so now comes the daring part of getting it to be on just so. Be on the skin just so. Good. Okay, so now you're gonna press it into me and get a good seal. So you're really gonna press. Yep. Good. Yay! He's a natural, folks. Now the dual purpose of this, I like to, keep my hand there for a little bit. The warmth of your hand helps warm up the adhesive and get a better stick to your stomach. And sometimes I also like to kind of like put pressure like right around the stoma, which you can see with these bags because it's got a little window here so you can see the stoma. And so I just kind of press around it just to make sure that that kind of seals in really nicely. If someone has broken skin, this can sometimes be a little uncomfortable, but it is so good to get that good seal.
Better to get a good seal the first time than to have to do another bag change, because that discomfort, I can only imagine, is just going to be repeated, if not more intense.
Yeah, exactly. So I would double check around all the edges and make sure that it's really good, press down all the way around and make sure it's got a good seal there.
Yep, no wrinkles.
Yep. So you just go through with your hand and kind of press down all around.
Looks pretty good to me.
Good. And then I would just go over it one more time to really make sure you get a good press. Yep, perfect.
All right.
And honestly, this is something too, you can ask your person to put their hand over while you're cleaning up or whatever. Have them, just have their hand on it for a couple minutes because it really does help get a good stick. Now the last thing that we'll want to do is
roll it up.
Yep, roll it up. So I'm gonna go ahead, I'm gonna move this garbage bag away because we won't need that anymore.
And we're not rolling in, we're rolling up.
Correct, yep. So I have a drainable ostomy bag. Some people won't have this part, but because my ileostomy fills this bag, 8 to 10 to 12 times a day, I need to empty it throughout the day, and that's why I have that. Woo-hoo. Okay, so, oh yeah, that's a good point too. So there's a little Velcro right up under here, so it kind of tucks up in there.
There we go.
Yay.
Clean.
All clean, all fresh. And now an optional step is that you can do the little barrier strip. I find that sometimes this adhesive bothers my skin, so I try not to do it too often anymore, unless I know I'm going swimming or, you know, taking a lot of baths or whatever, or if I start to see the edges start to get like wet and want to peel back. You'll notice this tab is sticking out away from my skin, and that's a good thing. That's exactly what we started with. It was something that he could pull back to spray the adhesive remover and help get the bag off for the next change. So, very good job. That was really good, actually. Hold on, let's pop it up.
Now that we're through that, I have a confession.
Okay.
I shit my pants. I need you to change my underwear.
Oh no. Come back for part 2. Okay, you guys, we did it. Oh my gosh. He was really good, actually. Hopefully that was helpful.
It was easy. Yeah,
Was it?
It was very simple. I definitely think that anybody and everybody just do it at eye level. I think it's so much easier to do that and feel confident versus leaning over and not really knowing what you're doing. It's better to have it eye level. It's not like it's just gonna, yes, it's active, but it's not shooting out and erupting.
Well, it can.
It can, I guess.
I will say it has. When I was pregnant and there was more like pressure on my belly, oh, it did. A couple times.
So maybe wear goggles.
And a face mask.
Face mask, you know.
No, just be kind of aware, and usually what it will do is it'll dance around, so you'll notice like, oh, something's coming down the line, you know.
It's like when you walk your dog, you can always, if you've had a dog for a while, you know when that dog's about to poop because it just makes some certain movement. So same thing.
The butt puckers.
Butt puckers up a little bit, you know, starfish.
Yeah. Oh, well, good job. I'm so proud of you. So proud of you. Yay. Okay. Well, thank you so much if you made it this far. I'm so happy that you are here supporting us and this channel. Make sure you like and subscribe and share with anybody else who maybe needs help with changing their ostomy or changing their partner's ostomy. And as always, we'll see you next time.
Yep. Hit the like and subscribe button.
Yeah, do it. Thank you. Bye.